morning, Miss Atkins. My name is Rebecca Warren. I'm the nurse practitioner here. I'm just going to take a seat. Is that okay?
Yeah.
All right, great. Okay, I brought some information for you to look over. So what brings you in today?
I need to change my birth control. I just keep forgetting to take my pills, and waiting for the pharmacy is just outrageous. So, and plus I'm in nursing school, so
awesome.
It's just one less thing to worry about, you know.
Okay, great. I understand that. So, let's just take a look at your health history and recent physical.
Okay.
I'm going to ask you a few questions. So, do you have endometriosis?
No.
Okay. Any history of pelvic inflammatory infection?
No.
How about cervicitis?
No.
Okay. Any cancers, cervical, endometrial?
Not that I'm aware of.
Okay, great. How about allergies? Do you have any?
I'm allergic to penicillin and copper.
Okay. All right. And was there a specific method you were looking to try?
I've heard of something. It's like a plastic thing that's inserted, and my friend has it, and she says it's awesome.
Yeah. That sounds like an IUD or intrauterine device.
Okay.
Yeah. So we wouldn't be doing the Paragard. That's the one with copper. So since you're allergic, we won't.
Okay.
We won't discuss that one.
All right. How does that work?
So the device releases hormones, and it causes your cervical mucus to thicken, and that prevents the sperm from reaching your egg.
Oh, okay. So I don't have to take a pill?
Nope, not at all.
Okay.
It prevents pregnancy without taking any medication orally.
Okay.
You still are going to want to use condoms to prevent STIs.
Okay. So will I have to be in surgery, or?
No, ma'am. We'll do it right here in the office.
Okay.
And since you're allergic to copper, like I said, I recommend the Mirena.
Okay.
Yeah.
So that's great.
Yeah.
So I'm just not sure if it's the right method for me, as far as like the pros and cons. What are the pros and cons?
So, IUDs are over 99% effective. It's, so only about 1 in every 100 women will have an unintended pregnancy.
Okay.
There's literally nothing more effective than IUDs other than abstinence.
Oh, okay.
Yeah.
Great. And then what would you say is like the biggest disadvantage?
Well, the time that you have to take to come into the office and meet with your provider, and then inserting it, and also that it doesn't cover STDs.
Okay. And I've seen YouTube videos and horror stories where it's been inserted and then it, either migrates or, makes my uterus fall out. Is that going to happen to me?
So I'm going to go ahead and preface that you probably should stay off of YouTube or Dr. Google. There's always risk involved, of course. However, it's extremely rare, and I personally have never seen these issues with any of my patients.
Okay.
There's always a risk for ectopic pregnancy.
Okay.
Your pregnancy in your fallopian tubes.
Okay.
So if you ever suspect you're pregnant, definitely come in.
Okay.
Okay.
And what are the side effects?
The most common side effects are changes in bleeding patterns.
Okay.
It can be increased, decreased, and sometimes women don't have any periods, which is really great.
That's awesome.
Mm-hmm.
Gotcha. And will it hurt when it's placed?
So some women report mild discomfort during placement.
Okay.
However, if you experience dizziness or pain 30 minutes after, it could be placed in the wrong area, so we'll have to redo it.
Okay. So other than like possible pregnancy, like if I feel that I might be pregnant, to report it to you guys or come in, is there anything else I can do to make sure it's most effective?
So the most important thing you can do is check placement.
Okay.
You do this by feeling for the strings.
Okay.
It's good practice to check once a month along with your self-breast exam.
Okay.
And if it does come out, you definitely want to use a backup method, because
Okay.
that means it's not going to work. So use condoms or something else.
Okay. And how much is this going to cost me?
Okay, so most insurance companies cover the cost of IUD, just a small copay, $10, $20.
Okay.
Some people walk away with spending nothing at all.
Oh, great.
Do you have health insurance?
Yes, I'm covered under my dad's plan.
Okay, great. Without insurance or government programs, it can cost up to $1,300, but usually it's covered, so
Okay.
we shouldn't have to worry about that.
All right. Well, thank you so much for the information. I feel like this is a good option for me.
That's great. You're very welcome. We can get you set up with an appointment. Just go to
Okay.
the front desk, and I'll get that prescription ready, and it'll be ready to go when you come back.
Okay. Awesome. Thank
All right,
you so
nice
much.
meeting you.
Nice meeting you.